Hi, my name's Chris. I'm a level 1 nursing student. I was wondering if I could follow you around today.
Of course, who are you gonna follow me?
Mr. Jarvis, I was wondering if I could get an S-bar report on him.
No problem. He's a 67-year-old male. He has a 20-year history of diabetes. He's in room 622. He is on a diabetic diet with a 2.2 sodium gram restriction. He has no known allergies. He's a full code, and his doctor is Dr. Phillips, and he has a moderate fall risk. He came in with a primary diagnosis of a stage 2 diabetic ulcer on his right heel with partial thickness loss, and it has an intact fluid-filled blister. His secondary diagnosis is type 1 diabetes, and for the past 5 days his blood sugar has been in the 300s, which it's usually around 120. His pain was recently at a 6 and was given morphine to bring it down to a 1. He admits to tingling in bilateral extremities, which has worsened in the past 3 months. He denies any change in mental status, and his parole is good. He denies a cough, dyspnea, wheeze, or chest tightness, and when his chest was oscillated, it was clear. Breathing is also unlabored. He denies any chest pain, palpitations, dyspnea, or edema. Heart sounds are present without any abnormalities, in regular rate and rhythm with no bruise. Denies any problems with his GI system. His abdomen was flat, symmetrical, and soft. Bowel sounds are present in all 4 quadrants. And he denies any problems with the urinary system. Recently, his blood sugar was at 242, so he'll receive 16 units of regular insulin on a sliding scale, and he's also being administered 18 units of Lantus, which he gets every night. Recent vital signs: heart rate was 76, O2 stat was at 96, and blood pressure was 128/70. Do you have any questions?
Why specifically is this client receiving this medication?
He receives the Lantus just to it's a long-acting insulin, so it maintains his sugar over night and throughout the day, and the regular insulin is given to him because his blood sugar is higher to bring it down.
What action does the medication have on the body?
So it promotes storage and inhibits the breakdown of glucose, fats, and amino acids. It also lowers glucose by the uptake of glucose in muscle and adipose tissue.
When should you question administering this medication?
Of course, the regular insulin, that's on a sliding scale, so if his sugar was low, of course you wouldn't administer any, or in normal range. The Lantus pretty much gets administered as long as the sugar is in a normal range. If it's too low, you might hold it, but you don't want to hold it if it's normal, because Lantus is long acting. It's going to keep it at that normal level.
Which physiological parameters should be monitored when the medication is being administered, and which vital signs must be monitored?
So basically, you just want to make sure that the blood sugar isn't too low. So an increased heart rate could indicate a low blood sugar, or shakiness, anything like that.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In the hospital setting, you want to use the 5 R's, which is right dose, right route, right patient, right time, and right medication. And of course, the patient always has the right to refuse the medicine.
What interventions must be taught for taking the medication safely at home?
At home, you want to make sure the patient knows side effects of a low blood sugar, and you want to make sure that they rotate injection sites.
What are the side effects and potential adverse reactions?
So, with the regular insulin, it would be if he didn't check his blood sugar and it was too low, and he gave a abnormal amount, it would put him into hypoglycemia. The Lantus also, you just want to make sure that the blood sugar is not too low before administering it.
How will you know that this medication is effective?
You check the sugar periodically throughout the day to make sure that it's maintained, not too low or not too high. That's for the Lantus. The regular, you want to come in and check not too long after you give it to make sure that you're not putting him into hypoglycemia.
Okay, cool.
Do you have any other questions?
Nope.
All right, let's go into the room.
Come in.
Hello, Mr. Javis Rondel.
Yes, sir.
I'm here with a level 1 nursing student. Is that alright if they watch?
Yeah, no, that's fine.
Alright, I'm gonna give you your Lantus and the regular insulin. You're gonna receive the regular insulin because your blood sugar was at 242, okay? So on the
Alright.
sliding scale, that's 16 units. Can you tell me 2 side effects of a low blood sugar?
Hypoglycemia, and that's gonna be dizziness and sweating.
Alright. Alright, let me just look at your wristband.
Alright.
Looks good. Do you have any allergic reactions in the past to this medicine?
No.
And is the ulcer giving you any pain right now?
Nope.
Still controlled by the last pain
Yep.
medicine you received? Alright. Alright, gonna scan your wristband and both medicines one at a time.
Alright.
So can you tell me your name and date of birth?
My name is Jarvis Reynolds, and my date of birth means that I'm 67 years old.
Yeah. Sounds good. Alright, so you're getting the 18 units of insulin. That's the Lantus. And according to the sliding scale, your blood sugar was at 242. So that would be 16 units. me your name and date of birth again.
Jarvis Reynolds, and I'm 67.
Good morning, my name is Anna. I'm on the level today. I'm going to start with you and you can go on your patient.
Sure. I'm going to take care of Mr. Louis Gray. He is 67 years old now. His name is 631. He's here with the state to diabetic cancer of the right ear, secondary diabetes, type 1, and he has been diabetic for many years. He also, his family history of myocardial infarction and one chemical complaint. His weather size, I got it at
Alright.
60.
Expiration dates are still good. Gonna draw up the insulin. So Atlantis getting 18 units.
His diet is 2 grams sodium restriction. And I checked his blood sugar. It was
One-handed recap.
242 at 8:30. His blood sugar has been high in the past 5 days. The read was 300.
And
He had a
16 units of the regular insulin. Expiration date is still good.
The length 5.5 semester. The wide is 2.5 semester. The wound on the right heel expect on the right heel, and it is stage 2. He doesn't have any dressing. The doctor just let it open. When I assessment his lung sound, it was clear.
Alright, and where do you usually have your insulin down at?
Back of my arm.
Back of your arm?
Mhm.
You want one on each arm or?
Sure.
Alright. This is your left arm here. You're gonna measure 18 units of Atlantis. 18 units of Atlantis. And your other arm is the 16 units of regular insulin for your high blood sugar here. Alright, how are you feeling?
Feel fine.
Alright. And I saw that you requested some insulin on the diabetic diet. So,
Some education on, yes, on the diabetic diet, yes.
yes, education. What did I say?
Insulin.
Alright. Yeah, so not education. So I printed out a sheet here for you that you can look over.
Thank you so much.
Do you have any questions about the insulin or anything?
Nope.
Oh, alright. Come back in and check your blood sugar a little later, okay?
All right. So, I had a question for you. Were there any pertinent pieces of information you reviewed before administering the client this medication?
So I just looked at his last blood sugar, made sure it was in an appropriate time when it was checked before I gave it, to make sure to look at the sliding scale for the regular insulin and to make sure that for the Lantus that it wasn't too low before giving it.
Did this information affect your decision to administer the medication?
Just a minute for the regular, just the amount, because that's on sliding scale. The Lantus, if it was too low, I would have held it for a little bit and then administered it later on.
Did this information affect how you administered the medication?
I mean, besides asking the client which location they wanted the insulin injection, not really.
Gotcha. All right. Well, that's all my questions.
All right.